Fibroids are growths that develop in and around the womb. They are non-cancerous and is made up of muscle cells and the fibrous tissue. They develop from the walls of the womb, otherwise known as uterus. This is the organ where the baby grows during pregnancy. The wall of the womb is made up of quite thick muscle layer, and from this muscle layer growths appear which are known as fibroids. These are supplied by blood vessels and these are hormonally dependent. They are more common within the age group of 30 to 50. They stop growing and sometimes they shrink after menopause. Not all fibroids will cause problem. It will depend on how many of them are, how big they are, and most importantly, where are they located within the uterus. They can actually grow within the muscle layer, they can grow outside the muscle, or sometimes they can grow within the cavity. If they continue to grow within the muscle layer or if they are growing outside, they can grow really big. They do not usually grow very big if they are growing within the cavity. Now, if they are growing within the muscle layer or growing outside, they can cause pressure symptoms by pressing on the other organs. For example, if they are growing from the front wall of the uterus, they can cause pressure on the bladder, needing the patient to go to the toilet more frequently. They can cause the sensation of heaviness lower down. On the contrary, if they are growing within the cavity, they can cause all sorts of problems with the period, like irregular period, heavy period, and painful period. So if you have problem with the heaviness down below, if you can feel a lump in your lower part of your tummy, or if you're having irregular, heavy, and painful period, you should seek advice from your GP, who will then organize an ultrasound scan to check the fibroids. Fibroids are really common. About 1/3 of the women will have some sort of fibroids. Most of them will be completely unaware that they will have it, but they are generally more common in the Afro-Caribbean women, in the age group between 30 and 50, the patients who are a bit overweight or obese, and the patients who did not have any children. However, not all of them will experience problem. Only 1/3 of the ladies with the fibroids will have some sort of problem that will need treatment. The treatment of the fibroid will depend on patient's symptoms and the fibroids itself. Most importantly, we need to consider if the patient has completed her family or not, because the mainstay of the treatment of the fibroid is surgery. We need to remove the fibroids. There is no, unfortunately, a medical treatment available which can cure the fibroids. If the patient has completed her family and if the fibroids are big and many, then hysterectomy is the main option. If the patient wants to keep the option of the future fertility open, they want to try for more babies in the future, then we need to remove the fibroids. That will depend on the size and the location of the fibroid. If the fibroids are growing within the cavity, we need to remove them by a camera with a special instrument. If they are growing outside the cavity, then they will need a major surgery called myomectomy. More recently, newer techniques are being developed. One of them is called uterine artery embolization. It is done by the radiologists, where they will put microscopic PVC glue to block the blood supply to the fibroid from the uterine artery so that the fibroids can stop growing and sometimes shrink. Newer technologies are also being developed, which are magnetic resonance guided high frequency ultrasound or laser ablation. But these are highly specialized areas. If you are suffering from fibroids, you need to seek advice from the GP and get referral to the specialist so that he or she can plan the management of the fibroid better.